Welcome to ENRICH Scotland's Rich Voices podcast. I'm Dr Rosie Ashworth, the Patient and Public Involvement Lead for ENRICH Scotland, and I will be co-hosting this series with Denise Munro, our Patient and Public Involvement Officer. This short podcast series will explore research in care homes and the important work being done. We will be speaking to the people behind the research, including people working in care homes and family members, on why care home research makes a difference. This podcast was co-designed with people in the care home community, including family members and staff.
In this first episode, we are asking a simple but important question. What is care home research? Why does it matter? And who is it for? We'll hear from researchers and care staff about what makes care home research unique, how it can improve daily life, and why collaboration and lived experience are key. We are joined by ENRICH Scotland's co-chairs, Dr Susan Shenkin and Dr Emma Law. We are also joined by Dr Jenni Burton, a researcher based at the University of Glasgow. Thanks for joining us today. Could you tell us a little bit about yourself and your involvement in care home research, please?
Hello, I'm Susan Shenkin. I'm a reader in Ageing and Health at the University of Edinburgh and a consultant in older people's medicine at NHS Lothian, and I'm co-chair of ENRICH Scotland.
Hello, I'm Emma Law and I co-chair ENRICH Scotland. My background is as a nurse with 35 plus years experience of nursing people with dementia in lots of different places, including a long stay ward. And my background of dementia nursing led me towards research, and that's where I ended in research, which I absolutely love. I ended up doing a PhD, and my PhD subject was about research in care homes, looking at issues of participation and citizenship. So that's where my interest of research in care homes comes from.
And Jenny?
Yeah, so I'm a junior doctor specialising in sort of training in the care of older people, but I'm also a care home researcher based at the University of Glasgow. And my care home research has a sort of number of different angles involving data about residents, pathways into care, better understanding the populations living there, and some work involving staff and their experiences, particularly around COVID.
First, we discussed who ENRICH Scotland is and how they support research.
So ENRICH Scotland is enabling research in care homes. It's a network which we set up in Scotland to be comparable to the similar network in England, which brings together care home staff, residents and researchers to improve the design and delivery of research for the benefit of people who live and work in care homes and those who care for them. It includes a wide range of different people with different backgrounds, and it's co-chaired by Emma Law and myself, and Rosie Ashworth is a patient and public involvement lead, and Irina McLean helps us on research and governance angle, and then we have clinical studies officers across the whole of Scotland, and our senior clinical studies officer Maria Drummond, who coordinate the whole network. ENRICH Scotland includes several different parts, and we have the Care Home InnovationPartnerships, which try and bring new innovation and tests of change to care homes that would be ready. We also have a stakeholder group that helps us to make sure that our direction continues to be what people in care homes would want. And then this is all brought together through the large network of research-ready care homes that have signed up to be asked about any research that's going on, and our partners in research, the Rich Voices, who are our patient and public involvement group led by Rosie.
Yeah, it started back in 2012 as just NIHR, National Institute for Healthcare Research, ENRICH. And I, in my role as the Dementia Network Manager, I was involved right from the start of ENRICH, and I was able to bring Scotland into the fold back then. What we found was, because we didn't have any dedicated funding for our time within ENRICH, it was very difficult to keep it going because it was really an add-on to my job. And although we managed to get quite a few people interested in what we were trying to do, we found it very difficult to keep the momentum up. But after the pandemic, or during the pandemic, the Scottish Government showed some interest in care home research and were willing to fund us, which has made a massive difference. And that really was when ENRICH Scotland was created in 2019. And in 2019, we had funding to bring on a full-time manager and also put some clinical studies officer time within local health boards, as well as boosting our patient public involvement arm with the introduction of Rosie and Rich Voices, Research in Care Home Voices.
Next, we discussed what is care home research, the different types of care home research, and why it's important.
Well, research is the development of any new knowledge to improve the outcomes for people. So care home research is development of new knowledge to try and improve outcomes for people who live and work in care homes and those who care for them. Research can use a wide range of different methods, and that can be simple things, asking individual people their opinions about things, and interviews and questionnaires, or more complex designs like trials where we test different medicines or different interventions to see if they can improve outcomes on a wide range of different things to do with people's health and care. These can involve both the residents of the care home, their families, their friends, and the professional staff who look after them.
Well, care home research is no different to any research done in any sector of society. The basis of research is trying to derive a generalizable or transferable new knowledge using scientifically sound methods. And different types of care home research may include the qualitative research, quantitative research, or mixed methods. And what these are looking at are the different ways of finding out about what's going on in the care home. So the focus is on the care home environment. There might be the practices, looking at residents, visitors, and loved ones. And the staff, of course, and in fact, any aspect of the care home running, environment, anything that I've already mentioned, which brings new knowledge to light using scientifically sound methodology.
And can you tell us a bit about why care home research is important?
Well, all research is important, and care home research is important because people who live and work in care homes are really important. We know that more than twice as many people have a bed in a care home as or have a bed in a hospital at any one period of time. And so many people are living and working in care homes, and the issues that affect people who live in care homes are the same as the issues that affect people who live or work anywhere. People who live in care homes are some of the frailest and most vulnerable people in our society, and it's really important that we have good evidence and evidence-based care to support their needs and make sure that they have the best possible outcomes.
So I guess research in this sort of context means to me the opportunity to explore questions that are really important, understand experiences, describe things that are going on, and help us think about how we can best deliver care and share that with other people, ultimately so that we can generate evidence to wrap around particularly care home practice. But also for me, a lot of that is about giving people guidance and support about the right things to do, and also making sure we're spending money in the right areas and helping support and enable things that we know to be helpful to people.
Have you always been interested in care homes? Was there kind of something that created a bit of a shift in your mind about researching this area? Has your kind of understanding of what care homes is changed, or did you have that kind of more stereotypical view, I guess, before doing more work in it?
So I've always had a real interest in older people and spending time with them. And before I went to university, even I worked with Alzheimer's Scotland in their day services and evening care services, and spent a lot of time with people living with dementia, but in a non-clinical, non-medical context, in a social context of how to support them. And I think that really sort of sparked my fascination for the need for there to be people who really care about improving understanding of how to support people. And I was really struck, and have been from quite a young age, about how the public perceptions of care homes are very negative. And one talk that I gave a number of years ago, I stood up and said, I want to live in a world where no one fears moving into a care home. And it sounds idealistic, because clearly there's lots of aspects about moving into care that don't appeal to us in terms of potential massive changes in our life and our routine, and that need to be looked after. But part of that is about, I think there's a lot that people don't understand about what can happen and the life that can happen within a care home. And I think that affects everything from how we decide or plan to make that move, or don't plan until we're in a crisis, and also then the really difficult decisions that individuals, their families are taking, and all the emotions that wrap around that. And I guess I thought that the research would help to play a sort of small part of trying to shine a bit of a light on that, but also to try to do so in a way that we better understand as a society what we need. Because there's often a lot of discussion of, oh, well, we don't really need more space in care homes, and more things can be done in people's homes. And that's not my kind of professional and personal experiences. And so I guess it's trying to triangulate some of that and just add a little bit to how we understand and talk about this. But it is interesting just how kind of pervasive these views are, and the impact that has on researching and working in this space, none more so than for the care home staff who we're involved in working directly with.
Brilliant, thank you. Is there any type of care home research that maybe, or method, that wouldn't work within a care home, do you think, or is maybe more commonly done in the community and not done enough in care homes?
I think there's a wide range of different types of research, and I think that we should allow people who live and work in care homes to make that decision for themselves. I think we should never say never for anything. We don't know what's feasible unless we ask people if that's possible or not. Some things there may be more infrastructural, governance or ethical challenges around, but I think it's a real responsibility for ENRICH Scotland to work with the people who live and work in care homes to develop those infrastructures to make sure that we can make things work for what people want for themselves. It's the best way to get the best evidence, and I don't think that people who live or work in care homes should be excluded from any of that, but they shouldn't be forced to take part in anything they don't want to either.
I think the important factor here is that traditionally care homes and the care home population were not included in research. So I think that it's been really important to include and bring into the research fold care homes, because learning about people in care homes has been enormously important because of the number of people who are living in care homes. And why would we not want to include people in care homes in research?
I wonder if you could tell us a bit about how you've seen care home research change over the term you've been involved in it.
Yeah, I think there's been a shift in attitudes towards care homes, and I think this has happened very recently with the advent of the pandemic. And I think care homes were particularly poorly treated during the pandemic, with this mass exodus from hospital care to care homes. And that was acknowledged, I think, by the political landscape changing. There's been a lot of loud voices about the inequity of bringing these people into care homes and the risks that people took. And there's been a lot of research since then about the stress and burden that this has placed on care homes, on staff, on the residents currently there, and it seems to have increased the interest in what's going on in care homes.
Yeah, so in terms of how things have changed, as I say, I probably really started working really mainly about care homes in 2015 with other research that had been a kind of broader older adult portfolio. And I think like when I was working on my PhD and the work about pathways into care, people would say, oh yes, we understand kind of what that's about, but the kind of idea of how that sits within and where care homes and their residents sit within the kind of wider consciousness was something that was quite varied as to who you would speak to. So it's always good if people know what your PhD means, and that isn't something that everyone can say. But I did feel that then that kind of and so what or where next was something that people didn't necessarily appreciate. And myself and a colleague in Edinburgh wrote an editorial piece about the invisibility of care home residents in routine data sort of during that time. And I guess what's probably saddest to me is that we knew that we didn't really know from a data point of view and at national scale who lives in a care home. We knew we couldn't really identify when people come into hospital from care homes or when they go out to care homes, even though those things have been recognised as being really important markers and things that health and social care should be able to measure. But we kind of accepted that care home related questions and data were a bit too difficult, and there wasn't really a kind of impetus to do anything or address that. And then as a consequence of the pandemic and obviously the huge and tremendous loss of life, the impact on staff, the sort of extent of outbreaks and the support or lack of support in some quarters has then shone a light on the need for us to know and better understand the needs of people who live in care homes and the staff who support them, and be able to identify at an early point what's happening and those interactions between hospitals, care homes and communities. And while people now accept that this is important, we haven't seen the same kind of uptake in support for the research in that area. And kind of going forward, we haven't really got to the point of saying, well, even when we're measuring, are we measuring things that are important? And are we just counting things that matter to the system? And then what do we do and how are we using that information to support residents? And so I think for me, there's an element of, yes, it's changed and there's clearly a lot more visibility of the need for there to be support for care homes, and there's a lot of interest. But I guess it's how we take things back to the on the ground. What are the things that care homes want to know and want to have addressed and challenged, as opposed to what does everybody else want to know about care homes, but making sure that there's that constant connection between data having a purpose and that purpose being to better serve the people who live there, and make sure that the staff who support them have the skills, expertise, experience, training, resources to deliver what's required. And we just need to be careful that there isn't a kind of rush for other people to do research to care homes that we all think is a good idea or that works in the hospital or other branches of practice, without stopping to say, hang on a minute, is this actually something that is a problem? Is this something that is a priority? Because every problem is balanced against lots of other competing priorities. And if not, then hang on, how do we go about finding those problems and priorities and making sure that we're all kind of aligned? And so I think there's a need for more, but not just lots of enthusiasm and lots of kind of academically or professionally led innovation to care homes. It has to come very much more collaboratively and preferably in the opposite direction.
It's really encouraging to hear that, obviously, that change, but also that need for collaboration and that recognition that actually if we're going to kind of sustainably do research within care homes, it needs to be with care homes, not to care homes. That sense of collaboration and that kind of more sharing of power dynamics, rather than it being all about how do we answer our question next. And I hadn't really thought about what you're saying about just how, even as the popularity of this type of research increases, we need to make sure that enthusiasm is used in the right way and not kind of as just another way of answering someone else's question.
Next, we discussed how accessible care home research is to the care home community.
Current research is now much more accessible than it was 10 to 15 years ago. And I think we have to thank ENRICH Scotland for that. With the interest in care home research, we've been able to take care homes and research and match them up and introduce researchers to care home populations which before they found difficult to access. So it's the ability to enable research to carry on and be embedded within care homes. And I think ENRICH Scotland has done a lot to help this. There's still a long way to go, but I think that there's been a really good impetus to get in research within care homes because of ENRICH Scotland.
So I think that in terms of the accessibility of research, I guess it's sort of where you start from. So can care home residents as citizens of Scotland participate in clinical studies like the other colleagues and peers that are living elsewhere in the community? And I think it's safe to say they cannot, because there are structural barriers around how people living in communal settings access opportunities like that, and often lots of exclusion criteria by researchers based on people's ability to go to a health centre or turn up somewhere and be counted. Those things are important and not to be dismissed, because although we might think of care home residents as older adults, frail, multimorbid, approaching the end of their lives, care homes in Scotland look after adults of all ages who have a variety of complex conditions, and evidence should apply to them as well. And while clearly there are major sort of considerations about researchers with clipboards turning up at care homes with test tubes and going into your house and doing research and making sure that we don't adversely affect the dynamics of the care home environment, and we're sensitive to that, there's also a thing about opportunities, which is that people living in care homes should have equitable access to participate in studies, and researchers should be designing research in an inclusive way that allows residents, some of them can go to the football, they can go to the hairdresser, they can go out to cafes, they should be able to participate in research that is equivalent to their peers. I guess then there's a secondary issue of how you involve residents and their families, and again how you do that in a non-intrusive way, because again the idea of coming in and studying the care home is a very intensive approach, and one in which even in hospital we recognise, oh hang on a minute, sort of studies in which we observe how people behave have to have a very high level of kind of justification.
Yeah, when I was doing my work for my thesis, what I did was I interviewed a number of care home residents. I interviewed carers who were visiting their loved ones. I interviewed the managers of care homes and the staff who worked within that care home. And I also ensured that I involved people with dementia in my research. So I took my thesis protocol to the full ethics review through Scotland ENRICH, which looks at including people who don't have capacity and to include them in my research. And for me that was very important. Having worked for many, many years with people with dementia, I felt it very important that I could involve people with dementia in the research I was doing.
Finally, we explored how people can get involved in care home research.
Well, like any research, I think anybody who wants to get involved in research can do. I think there's often a perception that research is something difficult and scary, and it's a word that people can sometimes be nervous about. And I think that part of the work that we've been doing together is to try and demystify that, to understand that research is only providing new knowledge to improve care. And we do that in a lot of different ways, but really the fundamental understanding of that means that anyone who would like to be part of that journey can be. One of the really interesting things is that people can take part in research without even having to do anything. That by being part of health or social care system, your routine data can be used to provide insights into health and care without you having to do anything more than being part of that system. And I think that's a really nice opportunity for people who would like to help to support health and social care development in the future, but who don't feel able to participate in specific studies, to actually help to provide new information and to develop innovative and new solutions to problems that they might see themselves.
If somebody wanted to get involved in that way, so to allow their data to be used but not necessarily want to be involved more than that, would they have to opt in or opt out? Is there already a kind of structure in place for that type of sharing of knowledge?
At the moment in the NHS, certainly, by participating in the NHS, it's assumed that you are willing to have your data used for appropriately ethically reviewed and appropriately governanced studies that are done with the right questions and making sure that people understand that that's done in a very organised and curated way. But it is possible for people to opt out of that if they want to do that. In social care, I think the systems are less robust and less well established because the use of routinely collected data in social care, such as using electronic care planning software in care homes, is more new. And I think we do need to have a conversation with people who are in care homes to understand how we can best use that in a way that isn't breaching any confidence and make sure that all data is used in an appropriate ethical way.
One of the attractions of working with data is that thing of particularly routinely collected data that are already being gathered, is that idea of there is no burden to residents by using that data. It's already in the system. And also you can involve all residents in the home, not just those who can sign up to the specific terms and conditions or have someone to do that on their behalf.
And how would residents, relatives, staff and others in the care home community find out about how to get involved in care home research?
At the moment in Scotland, we're trying to be the one-stop shop, the hub for people to come to for any information or advice about care home research. We hope that our network will continue to grow over the next few years and that we now do have clinical studies officers in place in every region in Scotland. And care homes can sign up to be research ready, to say that they are willing to be contacted about research to find out if they would be interested and if they'd like to take part in that or not.
Well, thank you, Susie, and thanks also to Emma and Jenny for chatting with us and for sharing your experience and knowledge of care home research with us. Thanks for listening to our first Rich Voices podcast episode, where we have explored what care home research is, why it's important, and how people can get involved. If you've enjoyed it, please follow and share as it helps others find the series. If you have any feedback, we'd love to know if you found it helpful, as it can shape our future activities. You can follow us on Facebook, X, LinkedIn, and you can find out more about ENRICH Scotland's work on our website. In the next episode, we'll be exploring the impact and benefits of care home research. Thanks for listening.